Thank you so much for joining us today, and welcome to everyone who just joined. Today's session will focus on care delivery, and we'll be diving into the 3 ways that we offer care here at Arista MD. A couple of quick housekeeping notes before we begin. You will find a Specialty Care 360 overview in the handout section, so feel free to check that out at any time during the webinar. Now, I'm excited to introduce our presenter today, Dr. Yulia Jesmer, our Chief Medical Officer here at Arista MD. Dr. Jesmer is a board-certified internal medicine physician with deep expertise in value-based care and digital health, and we're thrilled to have her here with us today. With that, I'll turn it over to Dr. Jesmer. Yulia, take it away.
Thank you so much, Tiffany, and thank you everyone for joining us today. It is wonderful to get to see folks on the call, and as Tiffany mentioned, please feel free to ask questions. Would love for this to be a discussion as well. I am very excited to talk about best practices in integrated care delivery and the model that we have built for getting specialty care to patients together, which includes taking on a continuum of care across modalities, which include e-consults, virtual specialty or telehealth, and in-person care. So let's start first with the problem. As I know we have all seen, the main problems in specialty care come down to access, care coordination, and cost. For access across geographies, we see that it takes patients 2 to 4 months and sometimes even more to get an appointment, which leads to delay in care for patients. And that's both for folks who could have had their issues addressed earlier, as well as for folks who are getting worse and may end up in the hospital. Care coordination is often limited. About 30 to 50% of appointments are never made. And for those that are made, the PCP often find themselves out of the loop. I know that whenever I send a patient to specialty care, I have to actively chase after them, or they're just completely gone. And then by the time they come back, the patient is frustrated when I have to ask them what happened at the cardiologist. And finally, there's, of course, the cost from unnecessary appointments and testing that may occur, as well as from delays in care for patients. All of this can, of course, lead to great frustration for both the PCP and the patient. Now, that's on the PCP side, but on the specialty side, it's also a challenge, and there are many inefficiencies for everyone involved. Specialists see a ton of referrals for patients who have low acuity care and could have been seen or had their care addressed more directly and faster. This also creates delays for folks who have higher acuity and need to see a specialist in person, but the schedule is backed up and then they can't get in. Many referrals end up being sent to the wrong specialist, which further adds to the delays. And then with these delays, the patient may end up seeking care at the ED, or they may get worse and end up in the ED anyway. There's also limited coordination and access to records, so patients get duplicative testing and care. And again, there's so much opportunity to improve the access and the care coordination and the costs of care for patients and for their providers. Now, our approach to care delivery is across 3 different modalities according to the needs and the complexity of the patient's care. These include e-consults, virtual specialty or telehealth, and in-person care. We are deeply committed to being the extended care team to the PCP, who is the quarterback of care, and we take on the entire continuum of these modalities to increase access to specialty for PCPs and their patients, and to get the care that the patients need to them faster and in the most appropriate care setting. The first of these is e-consults, and we'll go on a deeper dive into each of these in a second. But the first is e-consults, which is all peer-to-peer, PCP to specialist, in which the PCP manages the care directly with the specialist guidance. Then we have virtual specialty or telehealth, which is providing telehealth care directly to patients, so specialist to patient. And this is for folks who may not need in-person care, but they do need to interact directly with the specialist. And finally, there's in-person care for folks who do need a procedure or a more hands-on physical exam. Now, starting with the e-consults, this is a very rapid-fire way to get specialty care directly to patients and to support the PCP at the center of care. Consults are turned around by our specialists within about 4 to 6 hours, and so it really helps to limit any delays that patients are facing. So for one of the barriers that we hear about from our PCPs is that it takes time to submit an e-consult, and PCPs are very busy. As a PCP, I completely get that. There are so many clicks and things to follow up on, and you got to call one daughter and call the other daughter and then call the third daughter. And there's a ton of administrative work on top of all of that. So PCPs, our goal is to simplify and to make it as easy and straightforward as possible for PCPs to get their patients the care that they need. We've simplified the system so that it reduces the time that they have to spend on the e-consult process, and it doesn't change their workflow. The process is that the PCP submits a referral the same way in their EMR as they would an external referral, and they submit their consult question. And then one of our nurse navigators picks up that referral, sees the question, and then curates the consult on behalf of the PCP. They will pull the relevant notes, the labs, the imaging, any additional information. They send it over to the specialist. The specialist reviews, provides a recommendation with a diagnosis and treatment plan, sends it back to the PCP, and then the PCP follows up with the patient to make sure that the care is delivered. But we're saving a ton of time up front for the PCP, so it limits those barriers. And again, the PCP gets the information back quite quickly. Now, this is an example of an e-consult. This is an endocrinology consult. It's been de-identified, but this was a real case. And so this was a 78-year-old gentleman with ESRD on dialysis and who had diabetes. And the question was about glycemic control, given that the patient's Levemir was going to be no longer covered by insurance. Now, Dr. Clifford reviewed the case and then first suggested checking the patient's fructosamine. And given that the patient has anemia and is on ESRD, he then provided a very detailed set of recommendations about discontinuing glimepiride, as sulfonylureas increase the risk of hypoglycemia, and oral meds aren't recommended in dialysis. And then he provided a very detailed plan of how to change the insulin and how to titrate it. All of our e-consults our specialists are very intentional about providing detailed recommendations so that the PCP has an if this then that type of plan to follow with their patients, and then they can always reach back out to the specialist as well. Now, all of the specialists for both our e-consults and our virtual specialty programs, they're all board certified, they're fellowship trained. They're also very passionate about value-based care and helping support PCPs and increasing access to specialty care. They also love the continuity of care that they see. Some of our PCPs have their favorite specialists, and they really get to know them through caring for patients and co-managing their care together. We also, again, are very committed to continuity. And so if a PCP submits an e-consult for a patient in a particular specialty, let's call it GI, and then a few months later, the same patient has another concern in GI, that consult will go back to that same specialist. They already know the patient, they already know the PCP, and that really ensures the continuity of care for the patient. Now, there we go. Now on to virtual care or telehealth. This is for patients who need to directly interact with a specialist, but they don't really need the in-person care, which again, often takes about 2 to 4 months to get an appointment with, and for depending on the specialty, some specialties like rheumatology end up being about 6 months, and that's across geographies of all of our partners. Telehealth appointments for us in our model, we make them available within a few days. Again, we're trying to cut down the delay so the patient doesn't have to wait, so their condition doesn't worsen, and so that they have a better experience as well and are able to get back to their quality, focusing on their quality of life and the things that matter most. We also integrate with the PCP as their extended care team. So we're able to coordinate and collaborate with them, again, saving them months of having the patient from having to wait and from having to navigate the healthcare system, which can often be cumbersome and challenging. So for our model, we offer telehealth within 7 top specialties according to access barriers, cost, and these are the ones that we see our partners have the greatest needs in. These include cardiology, dermatology, endo, GI, MSK, neurology, and rheumatology. About 2/3 of referrals can be managed through virtual care, which is, again, faster than in person and more integrated than with the PCP. And we hear a lot about the technology barriers, especially for seniors, that may stand in the way of this. But what we've seen in practice is that a lot of seniors are very accustomed to telehealth they became accustomed during COVID, and now it's almost not quite second nature, but almost second nature for them. And then for those that it isn't, most can figure it out with a bit of support from our care coordinators who can do a tech check with them. And then finally, the other option that we offer is that we can set up an iPad within a PCP office. And so when the patient comes in for a PCP visit, we can make sure to schedule them for the virtual specialty as well if they need it. Now, within our model, patients are either referred through the PCP or they can be identified through the e-consult process, in which in cases that may be more complex or a patient needs a direct interaction, again, eliminating those delays. And then for the virtual and the telehealth, these can either be episodic or longitudinal visits. But the ultimate goal of our program is to graduate the patient back to the PCP for ongoing care. Now, within the care ecosystem, what we've seen with our patients is that this option is not only helpful for reducing care, but it's also helpful for patients who have geographic barriers, if they live in rural areas, or for folks who have transportation challenges, or even for folks who just really appreciate the scheduling flexibility. I think this is an opportunity to really increase the capacity and to have greater access to specialty. And what we see is that all of our specialists have a value-based, because our specialists have a value-based care orientation and become a part of the PCP's extended care team, it really allows for us to collaborate with the PCP and to provide greater evidence-based care and greater care coordination, which we've seen both our patients and providers appreciate. Now, finally, we get to in-person care. Now, the vast majority of patients, like we just talked about, can benefit from e-consults and from virtual care, but there are about 1/3 of patients who still do need that in-person care for a procedure or a more hands-on physical exam and evaluation. In those cases, with the e-consult and virtual, what we do is we manage the initial first steps, so the initial diagnosis, the initial treatment, and then refer the patient and help navigate them to in-person. And so we've saved them time and cut off additional steps so that the patient, by the time they get to the specialist can take the care on to the next steps. Now, for the navigation piece, there are, and I think I'm going to skip that one. For the navigation piece, there are 3 ways that we go about this. We piggyback on the first way is that we can piggyback on the PCP's network to support their referral model and their referral patterns and make sure that the specialists are in network. These are folks that usually the PCPs may know, and so we will follow the established protocols. If access is a challenge, then we can help identify a network of in-person specialists who provide high-value care within the value-based care ecosystem. And then there are also times that we can support making a specialist available on site as well. So that is our entire continuum, a brief overview of the continuum of care that we can provide. So taking on the care according to the patient's complexity through a combination of e-consults, virtual specialty, and then navigation to in-person as needed. Our program is designed to increase access to care, to enable a better patient and provider experience, and to really have a strong financial impact by reducing low-value care and really focusing on evidence-based care, reducing downstream costs from duplicative testing and treatment, and reducing ED and hospital admissions by getting the patient to the right care at the right time and in the right place. So thank you so much for your attention, and I would love to answer any questions.
Thank you so much, Dr. Jasmer, for that incredible presentation. We really appreciate you sharing your time, your expertise, and insight with us today. Before we jump into the Q&A, just a quick reminder for everyone, our poll on care delivery challenges is still open, and we would love to get your input if you haven't responded yet. Also, don't forget to download the Specialty Care 360 overview. You'll find that in the handout section. And this is your last chance to submit any questions in the chat. We'll try to get to as many as we can. We're going to go ahead and kick off the Q&A now with a few great questions that have already been submitted to us. First up is, what kinds of specialties are most commonly addressed through the eConsult platform?
Yep. Great question. So it depends on the partner and on what the need may be. And so some of our partners have embedded specialties. Some of our partners have deep expertise in specific things, such as cardiology. But what we see across the board is our top 5 specialties are endo, derm, cardiology, nephrology, and I bet the last one sort of alternates between neurology and rheumatology.
Thank you so much for that. Our following question is, how does Arista MD Solutions support organizations moving towards value-based care?
So great question. So we love working with groups who are in the both groups who are solidly in the value-based care space, as well as folks who are in the transition period. And so we collaborate we start off by identifying what the organization's needs are and how we can best support them. Some folks are focused on a particular specialty and increasing access while reducing costs. Some want things across the board. And so our program is very modular. We've designed it to be, everybody's model is slightly different and has specifics on how the care model is set up, how the ecosystem is set up. And so we call ourselves a white glove service, in that we are very hands-on and will identify your needs and figure out how to best fit them. So again, for example, some folks, want a variety of, e-consults, virtual specialty, and the whole navigation. Some folks exclusively focus on the virtual specialty, and some folks want more upstream care. And so going through a population health type of approach and identifying patients who would benefit. And so we're able to slot in different elements according to what the needs are.
Thank you so much for that. The following question is, what kind of feedback do you get from providers using the platform?
Excellent. Thank you. So we have both, every consult is on the eConsult side, every consult is rated by PCPs. And we hear a lot of great feedback around the quality and the step-by-step nature of the recommendations. And so the specialists, again, they understand that this is their opportunity to really impact the care of the patient and work with the PCP. So they get pretty detailed all the way down to dosing and how you change things. And again, the step-by-step approach that if this doesn't work, try this. If this doesn't work, try that. Or depending on which care cascade you're going down. And I think that's the number one thing that folks appreciate. I think they also we get a lot of, again, PCPs get to know their specialists. And so some will request a specialist, or like a dermatology, they'll say, please send it to Dr. Peppercorn or a particular specialist. And so we're trying to emulate the same experience as folks have in the in-person setting, where you may have your favorite specialist or someone you work with, and try to create that in the virtual setting.
Thank you so much, Dr. Jasmer. And we have one final question, which is probably my favorite question. Could you please share an example or testimony of how access to care improved after implementing eConsults?
Yes, absolutely. So I think we have lots of examples of this. I have examples from patients and examples from specialists who are in the local geographies. On the patient side, so many of these questions or so many of the referrals that folks sent in person, they could have been like a phone call, a discussion, an asynchronous e-consult. And so, for example, anything from we see a lot of diabetes management, we see a lot of heart failure management and such, and like really getting folks back on the right care pathway. I think an example of access, so we had an ortho, there was a case that I think a patient fell and had injured her wrist, and she couldn't get in to see ortho, and was trying to go see ortho, and there was like a 6-week delay, which is actually pretty quick. But the PCP submitted an e-consult, and the ortho is like, wait, you don't even need to go see ortho. Here's the bracelet, like here's what I see in terms of what's going on with your wrist. All you need is a brace. Here's a link to the actual brace that I would recommend in this case. And so really helped expedite the care for the patient, provided a good pain management plan and such. On the side of the specialists, we had one of my favorite stories is that in I believe this was in Florida, we got a phone call from a GI group. And initially I was very worried, what's going on here? And so in the phone call, ultimately, they asked who we were and what we were doing, and can they get more of this? Because by the time a patient comes, they're coming with a full set of recommendations from another GI, and like the PCP had already done the initial workup, and they're like, this is great. This really saves us time, and we'll get the patient the care they need.
That is so amazing. Thank you so much for sharing that. And thank you again for sharing your insights. I would also like to thank all of you for joining us today. This wraps up our session, but we hope that you found our session valuable and walked away with a deeper understanding of how Arista MD is transforming care delivery. A quick reminder, the recording of today's webinar will be emailed to you in the next few days, so keep an eye out for that. Be sure to download the Specialty Care 360 handout if you haven't already. It's still available. And thank you again, all. We hope to see you at a future Arista MD event. Thank you.
Thank you so much.